Hello, my name is Ash, a counselor in training. This is my Relatable study podcast for individuals who need help studying for their NCE, CPCE, and other related counseling exams. I'm going to go through many questions from multiple resources and make the answers relatable to both you and me. So get your listening ears on and let's get studying. Which of the following is true regarding validity and reliability of tests? A. Validity is how consistent the test is. B. A test may be reliable but not valid. C. A test may be valid but not reliable. D. Reliability is specific to the situation. The answer is B. A test may be reliable but not valid. This is true of validity and reliability of tests. Reliability is a prerequisite for validity. For example, scales can be reliable and give you a weight each time you step on it, but the weight could be wrong and not valid each time. What is over-identification within counseling? Over-identification is when counselors become overly emotionally involved with clients, which blurs the professional boundaries, and is when we feel someone's emotions to the point where we are losing our own perceptions. There are some signs of over-identification, which include rescuing the client, reacting emotionally to their story, and over-accommodating to their needs. And the therapists or counselors may have heightened anxiety and a strong emotional pull towards the client, which makes it difficult to maintain objectivity. It will diminish the treatment outcomes and therapeutic rapport and reduces the therapist engagement, which limits the client's access to care. This over-identification is when counselors become overly emotionally involved with clients, which blurs that professional boundary, and it will lead to countertransference. The ethical considerations of couple counseling differ from those of individual counseling. Which option below is an important point of discussion when obtaining informed consent from a couple? A. Confidentiality. B. The nature of therapy. C. The risk of therapy involving sensitive topics. D. Professional boundaries. The answer is A. Confidentiality is an important part of discussion when obtaining informed consent from a couple. Even though the rest of the answers are somewhat correct, confidentiality is the best one because you are specifically getting the informed consent and you have to go over confidentiality, its limits, its risks, so on and so forth. This is important for both couples counseling and individual counseling. The Minnesota Importance Questionnaire is used A. for those reading at an 8th grade level or higher, B. in context of vocational counseling, C. with groups only, D. with individuals only. The answer is B. The Minnesota Importance Questionnaire is used in context for vocational counseling, and it can be applied with groups and individuals. The Minnesota Importance Questionnaire MIQ is designed to measure psychological needs and underlying values for individuals wanting to go into vocational counseling. The Minnesota Importance Questionnaire MIQ is a measurement of an individual's vocational needs and values to help them identify which careers they would most likely go into based on their needs and values. What is an overlap of symptoms? Overlap of symptoms is the occurrence of smaller signs across a variety of disorders, complicating disorders. For example, bipolar disorder and bipolar personality disorder are very similar with overlapping symptoms. Both conditions can affect the quality of life and individuals' relationships, and they both include intense mood, low self-esteem, depression, and risks of suicide behavior and substance use. Though you would have to look more closely to distinguish the two from each other, because bipolar is more episodic and bipolar personality can wane to some degree because it is a lifelong pattern with sudden and short-lived shifts in moods. So the overlap of symptoms is the occurrence of similar signs across different disorders. Bipolar disorder and bipolar personality disorder is a great example. That is all 5 questions for this episode. Thank you for listening. Keep calm and study on.